Hi, this is Dr. Jonathan Youssef, Network of Your Optimal Health. Today's topic is going to be a lower back pain. This is Lifetime Family and Urgent Care, where we're looking good and trying to feel great. So today's topic is going to be about lower back pain and trigger point injections. One of the major complaints that people are complaining about is, guess what? Lower back pain. This is an area that many people have aches and pains from, and they are complaining that they're using this, that, stretching, trying to go to the gym, taking a medication, and they're just not getting relief. So what have we been doing in our office? Well, one of the modalities that we can add to what you're doing at home, or maybe add to what the other providers are doing, is trigger point injections. What are trigger point injections? Well, there are areas in your body that are painful, so they're little knots. Have you ever had a massage where somebody rolled over a little knot and ooh, that kind of like sent a signal and even made you nauseous, or maybe made you feel even more sick than you were? Well, that's the trigger point. It could be a bundle of nerves, it could be muscle, it could be an area where your bone is sticking out, it could be a tendon or a ligament. So what we do with the trigger points traditionally has been steroids. Depo-Medrol, Kenalog, dexamethasone. One of the steroids, unfortunately, what they do is they work great. Okay, I'm not gonna lie to you, it works fantastic, but the problem is it can wear out your joints. It can tear down those tissue, it can weaken it worse than it was before. So we don't want to do that. In our office, we do recommend cortisone shots, steroids, but sometimes we recommend Traumeel, a natural product that contains ingredients such as Arnica montana, witch hazel, daisy, echinacea, belladonna, chamomile. Any of those grouped together, given in the area of the trigger point, has shown significant relief. What happens to your lower back when you get a herniated disc, and why do trigger points help? This is the vertebra, two bones, in between there's a disc. And here's the nerve. This is why people feel numbness, tingling, shooting pain down their legs or arms, because sometimes what happens is they'll have a herniation like this. This is the bulging disc sticking out and hitting that nerve. So when we give a cortisone injection or a trigger point or Traumeel into this area, what it does is it starts to help heal the muscles and provide good nutrients so that it can stiffen up and harden up a little bit and prevent that herniation from sticking out any further. Or maybe it reduces some of the inflammation. We don't know exactly how it works, but it can help with the T helper cells, which go right to the area of pain and help with the trigger points to give you the relief that you need. So there's so many things you can do. You can do surgical options, you can do anti-inflammatories, you can do pain relievers, steroids, massage, and some of these can work for you. But what can you do in our office that can stand out is trigger point injections. How many do you need? One shot, and we do it almost 6 times. So we pick 2 or 3 areas of trigger point. We hit it every single time so that you can get the relief that you need. Around the 5th or 6th shot is when you get the maximum results. So if you're interested in doing them and you have lower back pain or pain anywhere else, like in the neck, the mid-back, those are my favorite places to get the trigger point injections. So if you need those, come see us. This is Lifetime Family and Urgent Care, your doctor for a lifetime.